That's Dr. James Neuenschwander. I'm a physician duly board certified in emergency and integrative medicine with over 30 years of experience caring for chronically ill children and adults. I have personally witnessed vaccine injuries in my career as an emergency room physician, and I can tell you it is not rare, and certainly more than 1 in a million. I've also heard hundreds and thousands of stories from parents and patients who will swear that it was a vaccine that caused their children's autism, autoimmunity, asthma, or other chronic illness. And I'm here today to tell you you're losing the confidence of those people and the healthcare practitioners that care for them when it comes to vaccine safety. I stood here in October and challenged this committee, the CDC, the NIH, anybody that would listen to a public debate on vaccine safety. And I can tell you my phone has not been ringing off the hook. So there's certainly a need for far greater vaccine safety research. Without that science, we can't have good communication. We can't repurpose the same old science because it's going to make things look better. We need more investment in vaccine safety science. Those are not my words. Those are the words of Heidi Larson, who is the director of the World Health Organization's Vaccine Confidence Project. So in 2013, the Institute of Medicine was tasked with the job of determining the safety of the entire vaccine schedule. What they found was there wasn't any evidence. There was no study comparing the health outcomes of a vaccinated population to a completely unvaccinated population. In response, the CDC created a committee of experts to determine how could you ethically do this study using current databases like the Vaccine Safety Data Link, the VSD. The result was a 2015 white paper in which they outlined the 20 most concerning health conditions along with details on how to do each of these studies. They even gave a specific example of how to use the VSD to study how the schedule affected a child's risk of asthma. That was 5 years ago. Nothing has happened. We're all still waiting. Do the study. If you want the statement, vaccines are safe and effective, to be anything more than an advertising campaign, you need this kind of science. And if you're unwilling or unable to do this, please step aside and give people like me access to the VSD. We'll make sure those studies are done. My God. Dr. Larson also pointed out that the vaccine hesitant are winning people to their side at a much greater rate than the vaccine confident. They're 5 times more likely to go to the other side. You're losing that battle. She also pointed out that there's a wobbly front line of health professionals that are questioning vaccine and vaccine safety. She said this is a huge problem that you can do something about. You guys have the power, and I'd like to remind you of the first ACIP committee meeting in 1964. Part of that committee meeting challenged this committee to responsibly advise for new projects and research. I think it's time to step into that responsibility. Please do the studies. Thank you.